my name is Dr. Brandy Roane, and I am going to be speaking to you about the sleep basics, so how to improve your sleep to improve your health. This is brought to you by myself and in collaboration with the Office of Care and Civility. So sufficient sleep is not a luxury, it's a necessity and should be thought of as a vital sign of good health, according to Director of the CDC, Wayne Gills. So what is sleep? If we look in Merriam-Webster's dictionary, they define sleep as the natural suspension of consciousness during which the powers of the body are restored, which is a lovely definition, but it's not a measurable one, and it really doesn't help us when we're talking about how to improve your sleep. So what can sleep mean? Sleep can mean how much sleep you got, which is duration, and understand that this is different than the time you spend in bed. When you slept, which is sleep timing, and how well you slept, which is quality. And it's also important to note that quality is not solely dependent on how much sleep you got. It is really that feeling of how refreshed you feel after you slept. So let's talk a little bit about the regulation of sleep, because that's going to help when you start to make changes or identifying what you might need to change or what could be affecting your sleep by understanding the processes that regulate it. So two mechanisms regulate sleep. We have your master circadian clock, or your suprachiasmatic nucleus, which directs the body's internal circadian rhythms, and you have your sleep-wake homeostasis, which tracks sleep need. Now, it's important to note that these are connected but distinct systems or processes. So let's first talk about the suprachiasmatic nucleus, or the master circadian clock. This sits in the brain and is the body's master circadian clock. Circadian rhythm comes from the Latin term circadium, about a day, and your circadian rhythm runs about 24.4 hours. So light is going to be your biggest entrainer of this master clock, meaning it's going to sync it and keep it on schedule. So how this works is light's going to reset the master clock each day. It does so when light enters the eye. The melanosmin expressing retinal ganglion cells determine brightness. From there, that information on brightness travels via the optic nerve to the suprachiasmatic nucleus directly in the anterior hypothalamus, as well as other areas of the brain. Now, your body is full of clocks, and these clocks are circadian rhythms, those 24-hour cycles of biological processes. That master clock coordinates all these peripheral clocks, so each new day when it detects brightness, it is going to then push an updated time to all the body's other clocks. Now, if this time is about the same every day, it's no big deal. Your peripheral clocks are going to stay synced and things are going to function well. If this time changes a lot, however, those clocks have to have time to update, and it can take anywhere from 3 to 4 days sometimes for some of the peripheral clocks to update to the new time. So you can imagine if it's constantly changing, that probably can cause some issues. So how does this work? If you look at this clock, you'll be able to see what's going on with your circadian rhythms throughout the entire day, and the fact that your circadian rhythms are really working throughout the whole day. So that master clock is going to help determine how sharp of a rise you have in your blood pressure in the morning, when melatonin is going to stop secreting, when you're likely to have a bowel movement, when your hormones are going to be released, and the rhythm they're going to be released on, when you're going to have your best coordination versus fastest reaction time versus highest alertness. So this is going to impact lots of things throughout your entire day. Now, I mentioned light was the biggest entrainer, the most powerful, potent Zeitgeber is what we call it, but there's other stimulus that can affect the timing of the master clock. These include social interaction, physical activity, meals, which is a very big one, because your meal timing and your content that you eat, or the food that you eat, is all going to feed back into that circadian clock. As a matter of fact, foods high in fat disrupt the master clock because the adipose tissue starts to send missed signals. So it can actually cause disruptions. So let's talk about what it means for you to have a disrupted circadian clock. So have you ever been jet lagged or traveled time zones? That jet lag occurs when the body's master clock and the actual don't match up. Well, circadian misalignment or social jet lag is when we unintentionally or intentionally dysregulate ourselves because we start shifting our time. So we don't actually travel time zones, but we'll stay up late and sleep in or things of that nature. Now, why is this so bad? Well, this disruption of the master clock is linked to serious conditions such as obesity, diabetes, cancer, depression, suicide. We see this in shift workers who become jet lagged, circadian misaligned due to shift work. But we can also do this on our own accord when we're not necessarily engaging in shift work, just by sleeping in on the weekend and then trying to get up super early Monday morning. So I told you there was two processes that regulate the body. The second one is that homeostatic sleep drive. And this is the pressure you feel to sleep. It's sleep dependent, it's going to build while you're awake, and it's going to decrease during sleep. Homeostatic sleep drive also reminds the body to sleep. So it's going to impact how long and how deeply you sleep as well. So is anyone else wondering how these work together? Well, this is just an illustration of these two processes together. You see, your sleep drive is really is determining that level of sleepiness, whereas your circadian rhythm, that master clock, is really a wake promoting system that's going to help with your level of alertness. So let's talk about what this actually can play out like during the daytime. So have you ever felt sleepy in the afternoon, that dip in energy between like 2 to 4, 3 to 5? If you're getting enough sleep, you will feel awake. And what is happening with that dip in energy is your circadian rhythm actually pulls back from promoting wakefulness for a brief period of time. So it's how alert you're going to feel during that pullback is really contingent on how much pressure you have built in your homeostatic sleep drive to either remain awake if you haven't built too much, or if you have too much at that time, you're going to feel sleepy and possibly take a nap. Well, what's so bad about napping? Napping means you're going to start letting pressure off, and you likely might not have enough pressure built back up by the time you're ready for bed, so it's going to result in you staying awake. So what happens when we don't get enough sleep? We can have a reduction in short-term memory, attention, mood, reaction time, learning, immune function. There's increases in motor vehicle accidents, work accidents. Hallucinations can occur, rarely, but they can. And we also have a reduction in our pain tolerance because our pain sensitivity increases. Now, it's also important to understand that many of these problems can come just from losing 1 hour of sleep per night. Obviously, if you're losing more sleep, it can impact you even more, and chronically experiencing this can be even more harmful. So it's important to really be considerate about your sleep and making sure that you're getting sufficient sleep. Now, if you think you might have a sleep disorder, there are specialists that you can contact, and this information is provided right here for you. And for more information on sleep health, you can visit these sites listed here, including the CDC, Sleep Foundation, and NHLBI.